In this video, we will be discussing alpha adrenergic blocking drugs. First, coming to the classification of the drugs, it is classified as two main categories: non equilibrium type and equilibrium type. That means competitive and non competitive. Non equilibrium is non competitive, equilibrium is competitive. Non equilibrium type include beta haloalkylamines like phenoxybenzamine. Equilibrium type is further classified as non selective and alpha 1 selective, alpha 2 selective. Non selective drugs includes ergot alkaloids like ergotamine, ergotoxin, hydrogenated ergot alkaloids like dihydroergotamine, dihydroergotoxin, imidazoline derivatives like tolazoline, phentolamine, miscellaneous drug like chlorpromazine. In alpha 1 selective drugs include prazosin, terazosin, doxazosin, tamsulosin. Alpha 2 selective include euhimbine. Coming to the pharmacological actions of these alpha blockers, first coming to effect on the blood vessels. As we have discussed, alpha 1 receptors, they are present on the blood vessels. So blockade of these alpha receptors causes blockade of vasoconstriction leading to vasodilation. Vasodilation mainly of veins. Venodilation is more, leading to a decrease in peripheral resistance offered for blood perfusion. Due to decrease in peripheral resistance, there is pooling of blood, leading to decrease in venous return and thereby reduces the cardiac output and BP gets decreases. BP is reduced due to decrease in cardiac output. Due to the decrease in blood pressure, if there is change in posture, it leads to postural hypotension. If you are lying down and standing erect, it changes the blood flow towards the CNS, and this can lead to postural hypotension, which is the main drawback of using alpha blockers. The adrenaline causes dilation of arteries as due to the beta effect. When we administer alpha blockers, it causes decrease in blood pressure, which is known as vasomotor reversal of Dale. Alpha blockers administered along with the adrenaline decreases the blood pressure. Adrenaline is known for increasing blood pressure, but as it blocks the alpha receptors which are causing vasoconstriction, blockade of alpha receptors causes vasodilation, and further adrenaline acts on the beta receptors causes dilation of the arteries, leading to decrease in blood pressure. This is known as vasomotor reversal of Dale. Further, alpha blockers leads to nasal stuffiness and induces meiosis. It is resulting from blockade of alpha receptors in nasal blood vessels and in radial muscles of iris. It increases intestinal motility due to partial inhibition of relaxant sympathetic influences. It can cause diarrhea. Due to hypotension, blood perfusion towards the kidneys will be reduced, leading to decrease in glomerular filtration rate. Due to decrease in GFR, sodium reabsorption is complete. Sodium is reabsorbed completely. Along with it, water is reabsorbed, leading to increase in blood volume. As the blood volume increases, the blood pressure compensatory is increased. Alpha 1 blockade inhibits ejaculation due to effect on vas difference. So contractions of vas difference are inhibited, leading to inhibition of ejaculations. It increases urinary outflow. This is helpful in hypertrophy of prostate. Thereby, it increases the tone of smooth muscle in bladder, trigone, and sphincter, and prostate is reduced. It has beneficial effects in hypertrophy of prostate where urinary outflow is hindered. Next, moving to the individual drugs like phenoxybenzamine and prazosin. Among these, prazosin has beneficial effects when we compare the phenoxybenzamine. Phenoxybenzamine has adverse effects of postural hypotension, but prazosin, as it is alpha 1 selective, there is no reduction in blood pressure and it does not increase so noradrenaline releases. So BP will be reduced, but there is no postural hypotension. Postural hypotension is not seen. Coming to the uses of alpha 1 blockers, it is used in pheochromocytoma. Pheochromocytoma is a tumor of adrenal medullary cells where there is excessive formation of catecholamines leading to increase in blood pressure. So these alpha 1 blockers can be administered to reduce the activity of noradrenaline or other catecholamines released during the excessive spur or release of catecholamines. Along with it, it can be used during surgery as there may be outpour of catecholamines in the blood during surgery of pheochromocytoma. In these conditions, phenoxybenzamine given pre-operatively and intraoperatively can reduce the adverse effects of excessive catecholamine release. It can be used for treating hypertension, but as it is not beta selective, as beta receptors are more prone for the heart activities, so it is used in less preference rather than beta blockers. It can be used to treat benign hypertrophy of prostate. Hypertrophy means increase in cell size where there is reduction in urine outflow. So due to blockade of alpha 1 adrenergic receptors, it decreases the tone of prostate or bladder neck muscles, helping urinary excretion. So it is beneficial in benign hypertrophy of prostate. Next, moving to the beta adrenergic blockers or the beta blockers. These are further classified. So these drugs inhibit adrenergic responses which are mediated by beta receptors. These are classified based on the action as non-selective and selective. Non-selective which act on both beta 1 and beta 2 receptors, whereas selective include beta 1, that is cardio selective blockers. Beta 1, beta 2 non-selective blockers are further classified as drugs which are not having intrinsic sympathomimetic activity like propranolol, sotalol and timolol. Drugs which have sympathomimetic activity, that is they are partial agonists, example pindolol. Drugs which have additional alpha blocking activity like labetalol and carvedilol. Beta 1 blockers which are cardio selective includes metoprolol, atenolol, nebivolol, esbutolol, esmolol and bisoprolol. So among these drugs, propranolol is considered as a prototype of drug and we will be discussing the pharmacology of propranolol. Coming to the pharmacological actions of propranolol or beta blockers. On the Cardiovascular system. On heart, it reduces the cardiac output, heart rate, and force of contraction. It prolongs the systole and ventricular dimensions are reduced, due to which there may be precipitation of CHF where there is decrease in blood perfusion. The cardiac work and oxygen consumption are reduced, which has a beneficial effect in angina pectoris. The total coronary blood flow is reduced, which is restricted to the epicardial region. High doses of beta blockers may cause membrane stabilization and can have anti-arrhythmic effect. Propranolol blocks cardiac stimulation action of adrenergic drug. Coming to the effect on blood vessels, when propranolol is administered, it causes increase in blood pressure along with adrenaline, which is termed as reversal of vasomotor reversal. That is, in reversal of vasomotor effect, we have seen there is decrease in blood pressure. But due to blockade of beta receptors with the propranolol, adrenergic activities are increased, leading to increase in blood pressure. So, blood pressure caused by adrenaline is enhanced when you administer propranolol. On continued usage of these beta blockers, they tend to increase the total peripheral resistance and the cardiac output is reduced, due to which the resistance vessels gradually they adapt to the change and thereby the cardiac output reduction causes decrease in total peripheral resistance. So due to continuous usage of this drug, the resistance vessels adapt to the change, that is reduced cardiac output, thereby the total peripheral resistance goes on decreasing. Both systolic and diastolic blood pressure will be reduced. So this is the mechanism by which these beta blockers they are used as antihypertensives. Along with this, it reduces noradrenaline release, which will be helpful for reducing the activity on heart due to beta blockade, and there is decrease in renin release from the kidneys, which further adds to the antihypertensive effect. Coming to the effect on respiratory tract. So on respiratory tract, it increases the bronchial resistance. So thereby it is not advisable in asthmatics, as beta blockers they cause decrease in increase in bronchial resistance by contracting the smooth muscles in the bronchioles. It is a potent local anesthetic, but due to irritation, it is not used as a local anesthetic. Coming to the metabolic effects, it blocks the lipolysis, which is induced due to adrenergics. It blocks the lipolysis, and due to which there is imbalance and there is increase in LDL levels. LDL HDL ratio is increased. The LDL levels are increased, which is not advised for atherogenic. So it can cause atherosclerosis. Beta blockers inhibits glycogenolysis in heart, liver and skeletal muscles. Thereby, it reduces the blood glucose levels and also has decrease in insulin. Insulin release is reduced, which may not be beneficial in pre-diabetics. So adverse. It is an adverse reaction in pre-diabetics where there is carbohydrate intolerance can occur. Carbohydrate intolerance can occur leading to diabetes. In skeletal muscles, it inhibits tremor and can reduce the exercise capacity as it is reducing glycogenolysis and muscle twitch. Muscle contraction also is reduced due to beta blockade. So thereby it reduces exercise capacity. On eye, it reduces the secretion of aqueous humor, which is beneficial in glaucoma. It reduces intraocular tension due to reduction in formation of aqueous humor. So it is a therapeutic use of beta blocker. On uterus, relaxation induced by isoprene or isoprenaline is blocked. Coming to pharmacokinetics, beta blockers are absorbed well orally, but the bioavailability is reduced. It is less. To increase the bioavailability, the drug is given along with food so that the metabolism rate will be reduced and more drug is available for absorption. It is metabolized in the liver and excreted mainly through urine by glucuronide conjugation. It is more than 90% plasma bound. Coming to the adverse effects, so it can precipitate CHF, congestive heart failure, due to changes in ventricular events. But on prolonged administration, this is taken off and it is beneficial in CHF due to blockade of non-adrenergic activity. It can induce bradycardia, reflex bradycardia. It can aggravate COPD, that is chronic obstructive pulmonary disorders like bronchial asthma, as it is contracting the bronchial smooth muscles. So it is not advised in asthmatic patients, are advised with care. Next, carbohydrate tolerance may be developed. So this is not advised in pre-diabetics. If it is advised, then it is with risk. Next, there is increase in LDL concentrations and triglyceride levels will be increased. It is causing tiredness due to reduction in skeletal muscle activity. It is due to beta 2 blockade. It causes cold hands and feet. Coming to the uses of beta blockers, it is used for all the heart disorders like to treat hypertension. Beta selective drugs like atenolol, nebivolol, metoprolol, etc. They are prescribed for treating hypertension. In treating angina pectoris, for treating arrhythmias, cardiac arrhythmias due to its membrane stabilizing activity. Next, in myocardial infarction, it decreases the secondary infarction or reinfarction, and also prevents sudden ventricular fibrillation at the second attack of myocardial infarction. So these drugs are advised in myocardial infarction. In CHF, that is congestive heart failure, it is advised due to it beta blockade activities. It can be used in pheochromocytoma along with alpha blockers so as to control the tachycardia or arrhythmia, which is seen due to increased release of catecholamines. It is used in thyrotoxicosis. It controls sympathetic symptoms like nervousness, tremor, severe myopathy, etc. and inhibits conversion of T3 to conversion of T4 to T3. It is used to treat migraine as a prophylactic drug, and as it is reducing aqueous humor formation, intraocular tension is reduced, and this is used for treating wide angle glaucoma.